Hello, team. I'm Dr. Shubham Kumar, practicing physician at Beta Darbhanga. Topic of discussion today is osteoarthritis and rheumatoid arthritis. Basically, we have to understand the differences between both the different forms of arthritis. Correct? Arthritis, when it comes to what comes to our mind, is like that it is the involvement of the joint. Correct? But there has a difference between the origin of the different kind of arthritis, be it osteoarthritis or rheumatoid arthritis. Arthritis as a common disease that affects millions of the people worldwide in two most distinct forms is osteoarthritis and rheumatoid arthritis. Despite similar symptoms of the joint pain, these two are different diseases with different causes, symptoms, and accordingly the different treatment plan for both these different type of arthritis. Okay. So, what are the basic differences between these two forms of arthritis? Let's briefly discuss about the things. The first one is the beginning and the progression, how the disease start and how the disease progress. So, when it comes for osteoarthritis, this disease develops very slowly over many years. So, definitely because it's a degenerative disease. Degenerative disease that means that's occur due to the continuous long-term wear and tear of the joint spaces. Correct? That's and that mainly affect the older people. Whereas rheumatoid arthritis, as such, the disease has no specific predilection for the old age, as this disease can occur in the young age people also. And this disease affect the joints, but very rarely this affect the larger joints. However, the small joint involvement of the hand or the feet is quite the most common presentation of rheumatoid arthritis. Let's discuss about the joints affected in the case of osteoarthritis and the rheumatoid arthritis. Osteoarthritis, this typically affect the larger joint, the weight-bearing joint, the joint which are larger as such the knee joint and the ankle joint like this. Weight bearing, that's due to the muscle and the joint wear and tear phenomena. Whereas rheumatoid arthritis affect the small joints and mostly the asymmetrical involvement on both sides of the body, a small joint particularly of the hands and the feet both alike. Okay, next is the underlying causes. What causes the osteoarthritis and what causes the rheumatoid arthritis? When it comes to osteoarthritis, this disease is caused primarily by the mechanical wear and tear on the joints. Quite understandably, due to the weight bearing phenomena, whatsoever the weight that is being borne by the either the hip joint or the knee joint. As the disease is advances, disease progress, the disease manifestation of osteoarthritis present to the people in quite the older age. Correct. Whereas the rheumatoid arthritis, this is not something mechanical or degenerative changes. This is an autoimmune disease in itself, in which the immune system itself destruct the synovial joint of the synovial spaces of the joint, and particularly the small joints. Right? And what's the effect of the rheumatoid arthritis and the osteoarthritis? This primarily relates to osteoarthritis often present with the osteoarthritis generally present with the affected to the joint itself, because as we have known it, like the wear and tear phenomena, obviously that has to be affect a particular joint where the constantly the weight is being borne by the body. Whereas rheumatoid arthritis, this is an autoimmune disease. Autoimmune disease, that means this autoimmunity is present in the body. This is affecting the joint in the initial stages, and as the disease progress or as the manifestations grow up, this particular autoimmune phenomena affect different multiple other systems also. That's why osteoarthritis is a articular problem. Rheumatoid arthritis is a multi-system problem. Multi-system problem, although it starts with the rheumatological condition, but sooner or later this affect particularly the heart, particularly the lung, and even the multiple different systems of the body as well. The effect, as after the effect, we have to discuss about the what are the methods the two treatment therapy of the rheumatoid arthritis and the osteoarthritis. Whereas the osteoarthritis, we primarily focus on the old age people about the pain management that can either be the pharmacologically or by the intra joint injection of the steroid. And in some refractory cases, we go ahead with the joint replacement option, be it partial or be it total. Okay, fine. Whereas there is a wide elaborate mechanism of the treatment for the rheumatoid arthritis. Rheumatoid arthritis per se, as such, we have told it because this is a autoimmune phenomena. Autoimmune phenomena, autoimmunity body build up slowly, and uh, this autoimmunity of the joint space is being treated medically by many of the disease modifying anti-rheumatic drugs. There are many new biological drug, investigational drugs that are we give the patient in combination. Whereas it comes to the DMARD therapy for the rheumatoid arthritis, we have the first line therapy in the form of the methotrexate, be it or initially the oral, and then later on we give it the subcutaneous route. And apart from methotrexate, we have sulfasalazine, leflunomide to bridge the therapy to gain the response to the therapy. Initially, we patch it up with a short duration of the steroid as well. And in the later stage, if they're not responsive to this therapy, we also go ahead with the numerous approaches of the biological therapy for the add-on therapy or even the single therapy, monotherapy for the rheumatoid arthritis. That's the about the treatment approaches. And in later stages of the rheumatoid arthritis, we are also having to manage the different systemic complication of the RA as such. We have discussed it. So, what are the lifestyle approaches and the methods to prevent the arthritis flare up? The first thing is to maintain a healthy weight. Being said is a weight affected then the weight borne by the joint that leads to wear and tear. So obviously if weight is less, that will have the much beneficial effect on the joint for the degradation of the joint spaces. So it's protective in the osteoarthritis. Next is staying active. Regular low impact exercise is being advised for the people, both the category osteoarthritis or the rheumatoid arthritis, to make the muscle less stiff and the joint being more mobile. Healthy diet to follow as such. Needless to say about any much thing as compared to any other disease, the osteoarthritis, be it or the rheumatoid arthritis, diet has to be very healthy with proper protein content, vegetable, omega-3 fatty acid content as such. We have to avoid injury because the stressor that affects that should be eliminated from the spectrum of the diseases. So we need to be very careful. And the next is the manage stress. Managing stress can trigger the RA flare up. Practices such as the yoga, meditation, and the sleep breathing exercise can help a lot. And needless to say, quitting the smoking helps a lot and lot for the rheumatoid arthritis that is implicated in the pathogenesis of the rheumatoid arthritis in a very early stage. So, as quitting smoking has a much beneficial effect in rheumatoid arthritis as compared to osteoarthritis. Correct. And we have to the monitor the symptom, regular checkup, consulting with the physician. We have to healthcare provider to manage and adjust the treatment plan accordingly because it is a dynamic disease. At many stages of the time, we have to modulate the treatment, sometimes escalate, and sometimes even downgrade the therapy. We have to do it. Next, we can have some short-term measures and the long-term to protect the joint. Short-term measure, we can take the painkillers. Painkiller can be NSAID or can be even the low-dose steroid and take care of the feet. And using the splint if required for the supporting the painful, weak or swollen joints. And the long-term methods to protect the joint is in the understanding the pain. What is the nature of the pain as a warning so that your body is demanding rest and you have to modify your activity according to that. And the next is use the assistive devices to when help is required. It is important much. A stable position, we have to maintain the position upright all the time so that joint erosions are being minimized to bare minimum. In addition to the above, ensure the joint safety by taking regular break during the work, ensuring the proper work surface height, using supportive sitting arrangements. Correct. Opt for the physical therapy and medical assistance if necessary. Thank you from my side. So that's the insight about the osteoarthritis and the rheumatoid arthritis as such. Thank you.